everybody, welcome to my talk today, tips to support your first year as a registered nursing associate. And I also have a video coming out that gives you tips for career progression as a nursing associate, whether you want to stay as a nursing associate or develop into a registered nurse role. Do subscribe to my channel, there's lots of free videos and I hope you find the tips helpful. And if you've got any comments or questions, do put them in the YouTube questions and I'll try and answer all of them. And give me a like if you like the video. So my first tip is don't try to do too much. Many nursing associates feel overwhelmed, and I meet many nursing associates and support workers who are aspiring to become a nursing associate. And when you first register, you can become overwhelmed with the accountability aspects. You're going to be accountable for your medications and for the care that you're delivering. And you're not alone. Everybody who starts a new role, registered nurses or senior nurses even, can feel overwhelmed at first, and you feel that you need to know a lot more than you do. Nobody expects you to know it all, and it takes time to develop confidence and those key transferable skills during your first year as a registered nursing associate. And it's not a race, so don't put any additional stress on yourself trying to do too much. It really does take a year or two to consolidate learning following your level 5 foundation degree. And one tip really is just to try and break your learning down into achievable goals. Go and talk to your educators or your line manager and maybe focus on one thing at a time. When I was a nursing sister, I would do this with new starters and newly registered nurses, for example, and ask them about the patients that they'd cared for that week. And if they had looked after 3 patients that had had a stroke, for example, I would say, right, let's focus on stroke for this week or for this month even. Go and look at the anatomy and physiology, the difference between an embolytic stroke and an aneurysm stroke, a hemorrhagic stroke, sorry, and the types of treatment. And then sit down with your patients, talk about how they feel, and look at the needs of your patient and how it's affected them holistically, biologically, psychologically, socially, and talking to relatives. And it brings it all together, and you'll remember the symptoms and you'll remember the treatments because you'll be linking it to the patients that you've cared for. So you'll be using like this person-centered approach, and that's a really good way to not feel too overwhelmed. And then you can start linking that to your medications, for example. Remember, your health always comes before work, and if you try and do too much at first, that's where your mental and physical health can deteriorate. So don't try to do too much. Second key tip, try and understand the key structures. So wherever you're working, you might work in the private sector, you could work for a charity, you might work in the NHS, in the community setting, or a hospital-based setting, or a nursing home. You need to understand the key structures that you're working in as a registered nursing associate, not as a support worker or as a student when you were doing your nursing associate trainee. You're now a registered nursing associate. So there will be key educational staff and structures, and there will be key management structures linked to any role. Wherever you work, there'll be a head of nurse education and a director of nursing or a lead nurse. And if you learn about those structures, it will really help you if you need support and guidance to thrive in your first role as a registered nursing associate. And also you'll be able to access support. You've also got a human resources structure that you can access, and it's really important to understand the roles within your clinical setting to be able to delegate appropriately. So knowing the levels of your support workers, what NVQ levels they've done and apprenticeships, and you're going to have so much insight because some of you might have been support workers before you did your apprenticeship, for example. You might have self-funded your nursing associate course. but have a look at what experiences they have, what skills they've got. Have they got NVQ? Have they got the care certificate? And then you know what you can delegate in your role when you're delivering your patient care. Also understanding the roles of manager, who is responsible for your learning and education, who is responsible for signing off your probationary period, and allied health professionals, is there a physio, an OT, what medics are aligned, and who's your human resources lead if you did want to go to them for confidential advice. Third key tip, access support. Never ever be afraid to access support from managers, from educators, wellbeing leads. You might have recruitment, workforce leads, human resource advisors. You can go to peer support groups. And if you don't feel comfortable going to the area, you can always seek confidential advice. There is freedom to speak up guardians, for example, and human resource leads should offer confidential advice as well. And also you can have union representatives as well that will do that. And life really is too short to spend 8 to 12 hours unhappy at work. So do speak to someone. And also it's everybody's responsibility to look out for each other, because we're a team. It could be the cleaner, it could be a doctor in an office that you find upset. It could be a support worker, it could be absolutely anybody. We should all be looking out for each other, being kind, compassionate and there for each other, and supporting each other to access support. So look out for each other as well. Prioritise essential learning. So when you first register as a nursing associate, you can be bombarded with your e-learning. You might have extra e-learning to do once you're registered. You should have an induction into your role. There might be a specialist orientation. Now, sometimes if you're doing an apprenticeship, often you're doing it and you're being seconded, so you're not seconded, but your manager will, sorry, I can't get my words out today. You'll be supported and you'll be applied internally. So you might have already worked in that area for a few years as a support worker. That's what I'm trying to say. Bear with me. So you might not need a specialist orientation and stuff, but you still need an orientation to your role and preceptorship period where you can access support. There may be a corporate team locally delivering preceptorship. So proactively ask about these things. You should have somebody to go to for a professional review to give you feedback on your performance over the next few years and to give you constructive feedback to support your development. So if you needed an extra additional study day in an area, or you've got an interest, you can go and talk to somebody about that. And clinical support buddies to work with you. Who do you go to ask for support on shifts when you're in on a day-to-day basis? You'll have statutory training and mandatory training, and that's compulsory. And your statutory training is training that's set in law with national health and safety, and mandatory training is compulsory, and that's determined by your employer, and that will be based on your job, your learning responsibility, your nursing responsibilities and your job description. And you might have escalation policies, risk assessments, equipment, medication that you want to look up in that area, especially if it's a new area to you, and patient information. What patient information do I have to educate my patients and promote in that area? So they're the sort of things you could prioritise initially, but don't try to do it all at once. Your statutory mandatory, I would say, to focus on initially, and then you'll be led by your specialist orientation, preceptorship, and whoever's going to be reviewing you and supporting you in your area. Next thing, don't compare yourself to others. Everybody does it. I don't now, I'm in my 50s. I don't care what people think about me. I'm not everybody's cup of tea, that's for sure. But don't compare yourself. It's really easy to see another nursing associate and think, oh, I should be doing this. Am I far enough ahead? Don't. You have individual learning needs and different strengths and areas for development, and it's going to be different for everybody. I've got a video on career progression for nursing associates. So just some tips if you're staying as a registered nursing associate, or you might make plans in the future to top up. So that's quite helpful. And it really is individualised to you and your career development. And I talk a bit about my career, and which was, you know, I didn't know what I was doing at first and where I wanted to be. I certainly didn't think I'd be an educator or setting up a YouTube channel in my 50s, but there you go. So regular professional development reviews is really important, appraisals, constructive feedback from others, as I said, and that will inform your development plans. So getting that feedback is helpful to address and to support your individual needs. And as I said, they're individual to you. Number 6, use available resources. So network with key professionals. Don't be shy, go out there, say hello, talk to people about your role, because not everybody knows what a nursing associate does. You know, they should, but they don't always, and that's the reality. So get out there and be advocates for your role and talk to people and tell them what you do. And that's really good to do at recruitment events, or if there's, you know, you can offer to help educators and to support workers and inspire them into roles, for example. That might be something you're interested in. You might have an interest in a certain condition and you might want to do a poster for the ward. There's lots of ways of sharing your knowledge and skills with others. Network with specialist nurses, advanced nurse practitioners. They have such expert knowledge, and they will adhere to an evidence base. That an evidence base will underpin their knowledge and their skills, and they're really helpful to go to if you're not quite sure in relation to care planning or an aspect of care. Go and ask them. Pharmacists are very helpful, clinical academics and researchers you might have in your area. You may have clinical governance leads. There may be a falls lead or a tissue viability lead who's really helpful with, you know, with wound care, for example. And librarians, junior, because some hospital trusts or community settings have got access to healthcare libraries, for example. And junior and experienced staff who have gone through what you're going through, and you can use peers and colleagues for support. Excuse me, I'm just going to blow my nose. Another tip is to look at patient information leaflets. You might be giving advice to patients. They may be going for a scan, and you could pick a leaflet up if you're not quite sure to talk it through and you want to gain some confidence. You can use that as a template to talk through. And you might want to talk, you know, there's some really good patient leaflets out there to do with illnesses, treatments, prognosis. There's NHS leaflets. So, you know, obviously you have to use leaflets that are registered with the NHS or with your employer, because they'll have gone through, or they'd have been audited and evaluated. And treatments and investigations, it's very helpful to talk through what will happen later. But if you're not sure, you can ask. If you're not sure what a treatment is and a patient asks you a question. And but as I said, these leaflets are very helpful, and you will have employer intranet sites where you might have a document store where your employer has a lot of this information, and also standardized care plans as well on the intranet. So I hope those tips have helped. If you've got any questions, put them in the YouTube channel, and you can contact me on my website or DM me on Twitter or on Instagram. And I wish you every success during your first year. So let me know how you're getting on, and good luck.